give it a couple of seconds. What are a couple of the key challenges that new innovators of medical devices are facing today?
Well, the innovators that CIMIT works with are particularly the physicians who are in the trenches, who are involved in making diagnoses in their patients. And to me, one of the challenges that they have is to recognize when there's a gap in diagnosis, what's wrong with the current way that patients are diagnosed, and to focus on those issues and look at those challenges as opportunities. And what makes that possible in the CIMIT community is that doctors who identify opportunities like that are quickly put in touch with engineers or technologists who then listen to the doctor and determine if they have a technology that might be relevant to what the doctor is trying to solve. So to me, the most important limitation is that aha moment when the physician realizes that, you know what, the status quo just isn't good enough, that we need more timely, we need more accurate, we need more predictive diagnostic tests. And even if they don't know the solution themselves, in a community like Boston, we can probably put them in touch with somebody that can work with them to get to that solution.
Okay. What is your advice for new innovators of medical devices?
Well, I think everyone has an innovator inside them. I think what happens to many, particularly physicians, busy physicians, whether they're in private practice or in academic settings, is that they get so immersed in the day-to-day activities of caring for patients that while they may have ideas for how to make things better in terms of diagnosis or treatment, they just don't have the time to pause and be introduced to a potential collaborator, get some seed funding, and move that idea forward. So the best advice I can give somebody who is, let's say, a closet innovator is not to ignore that little voice inside them that says, if only, but to take that as an opportunity to pause, contact me, contact somebody at CIMIT to say, you know what, I think I've identified an unmet medical need that innovation might help solve. And we want to partner with that person because they have they've identified this as a problem, meaning that they've understand how medical care would be improved if this problem were solved. So once a person goes through the innovation process, and I'm speaking of academic-based physicians, they become good at it and they become serial innovators. To me, the biggest hurdle is that first time. Rather than accept the workaround or accept just the way things are, to ask the question, gee, wouldn't it be better if? And then don't lose sight of that, and make that a conscious effort through collaboration and with funding.
Okay. Could you briefly describe the accelerator program at CIMIT, how that works?
Yeah, at CIMIT, the accelerator program, which is relatively new, is meant to take medical device projects that have already proven a principle of some sort. There may be a prototype, there may be some animal results, for example, and the proof of principle is there. But where there needs to be additional work with regard to the form factor or packaging or perhaps a small-scale clinical trial, that if these additional steps were taken, that it would be projected by the accelerator team that within a year and a half, that project would be taken up by industry in one way or another. And the accelerator team is composed of individuals who have a med tech background, who've started companies, who've sold companies, who are entrepreneurs or inventors, and together with the investigator team on a project, they join it and create almost like a virtual company, although the intellectual intellectual property, scientific directions remain with the investigator and their institution, but CIMMYT augments the resources of the investigator and the investigator's tech transfer office to create a type of business plan, create deliverables, timelines, and with additional funding from CIMMYT to say, you know, I think this proposal may be successful, to convert that, this project will be successful, and we currently have the funds to take on 3 to 4 projects a year, but we're hoping with additional funding that we could significantly scale that up.